Hi, I'm Allie Hoffman, the Senior Campaign Associate for Shot at Life. In this video, I'll explain what a personal story is and how to use yours to advocate for Shot at Life. A personal story is why you support Shot at Life and global immunization programs. So here's just a few of the reasons why you may support Shot at Life. Number one, you might be a healthcare worker, whether that's a nurse, a pediatrician, a pharmacist. You've maybe lived or visited abroad and seen the impact of these diseases on kids and families worldwide, whether it was as a Peace Corps volunteer or a member of the military, maybe even Doctors Without Borders volunteer. Those would all fit into this category. You could also be a parent and your child was sick from one of these diseases, polio, measles, pneumonia, rotavirus, or you've seen a family member suffer from one of these diseases, or you could even be a survivor yourself. Now, this list doesn't include all of the reasons why you may support us. Maybe you just care about children and you don't want them to get sick from vaccine preventable diseases. Your personal story is a really powerful advocacy tool because it makes policy real. A lot of times policymakers are just hearing numbers, like how many millions of dollars we're asking for, or all they hear are the statistics on these death rates. When you share a personal story, you're reminding them that these global health policies aren't just based in numbers. These policies have a significant impact on people around the world and on Americans here at home. And especially when cuts to our programs are being considered, it's important to remind policymakers of what those cuts would mean and how they'll change lives. Shot at Life has been able to consistently secure funding for our global immunization programs, even when other programs in the budget got cut. And this is because our champions are using their personal story to, talk to members of Congress and remind them about the importance of our programs. So you should use your personal story whenever you're advocating for Shot at Life. And you can have different versions, a 30-second, a 60-second, a 5-minute version, depending on how much time you have. So you can include it in the personalized section of our petitions, in social media posts. Obviously, you're limited with 140 characters on Twitter. But like I said, you can have different versions of these. You can also use it in your letter to the editor as well during calls and meetings with your elected officials, which is sometimes the most important and the easiest time to share your story is in those meetings, as you just have more time. So now that you know what a personal story is and why they're a powerful advocacy tool, let's go over how to make your personal story. It shouldn't be too long. Again, you can have different versions, but just briefly talk about your personal reasons for supporting global childhood immunization programs. So kind of the four parts of it is, number one, explain your reason for supporting these programs, whether it's your occupation, you're a parent, you're a survivor, or you just care about children. Number two, share how your experience with vaccine preventable diseases has affected you or your loved one, or, what's the story that hooked you when you decided this is something you wanted to start advocating for. Number three, work to make it global. So connect your experience to those living in these countries that are directly impacted by the funding for these programs. And lastly, end with a call to action. If you're sharing this with an elected official, this is when you would ask them to support our funding asks. And if you're sharing this with the general audience, this is a great time to ask them to join you in advocating for Shot at Life. So thanks for watching, and reach out to us at champions@shotatlife.org if you have any questions.